way we work changed dramatically over the last months. Our hospital in Clichy, next to Paris, is dedicated to digestive disorders, and within a few days it has been completely changed, and now it's an hospital mostly dedicated to COVID-infected patients. It has been dramatic. We increased dramatically as well the number of beds of intensive care unit. We multiplied that by 3. Also in our hospitals there has been transformation of the daycare unit into an intensive care unit and the endoscopy department into an intensive care unit, meaning that we are trying to create as much beds of intensive care unit as possible. And 2 floors, something like 80 beds dedicated to patients with COVID infection have been created as well. So this is really dramatic changes, but it means also that we are treating less patients without COVID infection. For instance, I'm responsible for the hemodynamic department, where liver hemodynamic department, where we are doing transjugular liver biopsies and hepatic hemodynamic. And for the first time over the last 50 years, when this unit has been created, we have been obliged to close the department to allow the nurses and the doctors to dedicate their time to COVID-infected patients. So these are really impressive changes. For patients with cancer, hepatocellular carcinoma, we have been obliged over the last week to reduce strongly the indication for treatments. Radiofrequency, chemoembolization have been dramatically reduced. So these are very impressive changes. On the one hand, big efforts were rightfully dedicated to COVID-infected patients because we had to, but on the other hand, it means that other patients are less treated. This is a very important aspect. How long will it take to us to cope with the delay we have taken in treating this patient? And importantly, it will depend also on the duration of the epidemic. Of course, yes. If it lasts 4 weeks, it will not be the same as 4 months. So the impact will be even more dramatic if the duration of the epidemic is long, and this is likely. So at the moment, it has been very interesting. There has been a phase of daily changes in the organization, the one I mentioned, creating everywhere beds dedicated to COVID, intensive care units, then stabilization in the number of beds, and now we are trying to reorganize and try to treat nevertheless patients with other disorders, and for us, patients with liver disorders, as much as we can with the available forces. This is the question. This is the big question that nobody knows, of course, at the moment. Everybody speculates. Initially, we thought it will last few weeks, but for sure it will not last few weeks. Today we had information in Paris hospital that in intensive care unit, 20% of the patients have a duration of stay of 20 days or more, meaning that this is a very long period of stay in intensive care unit for a single patient, and therefore it takes a long duration to go back to normal. We multiply, as I said, the number of beds in intensive care unit by 3, meaning that a lot of people are working there and therefore are not available to deal with usual disorders. And to go back to normal, we need to have, of course, dramatically less patients with COVID. And we are likely only at the beginning of the epidemic. In intensive care unit requires a lot of efforts and a lot of manpower, meaning many nurses, many doctors. For a single patient, you need much more people, much more healthcare providers than for a regular bed, I would say. So this takes a lot of forces. This is a new disease, and we've got many questions. We have, and hopefully research will provide us with these answers. We already have some answers. The first one is when you are infected, are you going to be protected in the future? Apparently, the data show that yes, there is a protection. How is the contamination? And then, very importantly, what is expected is test to diagnose even more accurately than currently, because currently PCR is not so sensitive. Also, it's good, it's not perfect. And most importantly, I think the next step will be serological markers, allowing us to know who has been infected and is now protected from infection and who is not. With this very important tool, we will likely manage the flow of the patient and the decision of lockdown and removing the lockdown. The unmet needs are the vaccine, but we are not sure that the vaccine will come rapidly, and also treatments for patients in intensive care unit, because currently this is supportive care, I would say non-specific care, with oxygen, trying to cope with these very hypoxic patients, but more specific treatment will be highly desired. But so these are the needs, and currently we don't have all these answers. For us as a pathologist, what we are interested in is a little bit more specific. What is the impact of this infection on patients with chronic liver disorders, typically patients with cirrhosis, but also transplant patients, and more generally patients with immunosuppressive therapy, like patients with autoimmune hepatitis. For us as hepatologists, these are the questions. This is absolutely true. We received, particularly in the first days and weeks, a huge amount of emails from patients saying, what's my risk? What should I do? What should I not do? Should I go and see my parents or my my son with another person, etc. So very difficult and precise question that we had to answer the best we can. So now people are getting more and more adjusted to this new situation, and the number of questions is decreasing. Mm-hmm. And also this is an opportunity, as you mentioned, to change our practice and to go into the telemedicine. So we are doing that, most, if not all of us, to avoid the patient to come to the hospital and taking the risk of being infected. So we are doing that, and we are also, it fosters the development of new tools. So this is something that is interesting. I would say, I take this opportunity to say, among the positive aspect of this epidemic, this is how the healthcare providers are, say, good, impressive, are dedicated to their patients. This is really something that impressed me a lot and is still impressing me. We had a storm of people arriving from people, fellows doing research that left their research and came to the hospital, nurses okay to put aside their usual practice to go to COVID-infected patients, which are specific patients, I would say. It's really not easy having these patients highly hypoxic. So people are really committed, and this is working in a team manner. So it's really, really good, and it has to be, I think, strongly highlighted. There is a need for dedicating resources to health care in general, hospital in particular. This crisis really illustrates that, and shows that there is a need to invest for government in the healthcare system, because at some point, if people are not healthy, everything goes bad, the economy goes bad, etc. So there is, in this period, at least in France, but I think this is general, there is a tendency to try to decrease the amount invested in health by the government, and I think it shows clearly that we should not, the government should not decrease too much the resources dedicated to health. We need buildings with appropriate devices, etc. And we need also people trained and able to deal with these difficult situations. This is a significant point. A little bit like treating patients with liver disorders is strongly affected by the pandemic. Research on liver disorders is also affected, meaning that people who usually work on liver disorders are spending a significant amount of their time treating patients with COVID infection. And for those who are not treating patients, doing research on COVID. So I think for some weeks, maybe some months, there will be a delay, and the European Union is aware of that, and already, I think, looks favorably the request for postponing a little bit the milestone delivery. It's clear that this pandemic has effect, broad effect, including on research not dedicated to COVID. On the other hand, research dedicated to COVID is hugely favored, which is normal, I would say. And even the people working with me, the research associate working with me, are stop their project dedicated to liver for maybe 1 month or 2 months. I'm doing the research dedicated to COVID because big progress and rapid progress are needed on this topic. Yeah, we are learning a new disease, and also the impact on the liver is so far unknown. So for sure, we are learning that. It's highly appreciated. We are receiving people are uploading in France at 8 p.m. in the evening, like in other countries, which is a nice thing for people treating patients. And also we are receiving nice emails or drawing for children, which is also very encouraging for people working hard to treat these patients. I would say, to me, the take-home message, this is how people are committed to treating patients. This is really, it impressed me a lot, and this is very positive. And also, these patients are very severe. And when you see these patients, you understand how important it is to rapidly restructure the organization and to be able to treat them immediately.